just pulling. Yeah, so while I pull up the presentation, I'll just speak a little bit to who I am. So my name's Sam. I use they and he pronouns. I am currently the acting president of the Acadia Students Union. Uh, and basically that just means I'm here to, lead and direct the organization and represent them in groups like this, but also abroad. So I'll get started a little bit, if this will work. Sorry, just one second. Yeah. Let's see if I can. Do I have permission to share my screen? Oh, looks like my other two have joined in. Let me see. It looks like I can.
You should have.
I think I do.
Yeah.
So I will do this. And okay. So this is the pre-arrival Acadia Students Union message. This is prepared by my lovely VPs, Zaida Chum and Sterling Shannon. So I'll just get a little started with who the ASU is. So the ASU is all students. You who are coming in, the students who are already here, and us alike, we are all the Acadia Students Union. We represent every single student. And yeah, so we represent all of the students, and every year we will choose representatives from that student body to sit on our representative council and to work on our organization to figure out how we can best provide for students. So what do we do? We have these two different groups, the executive board who work through the summer to prepare things for the year, and then SRC comes in and we find the directions that we can go to best support our students throughout the year. This can be through academics, this can be through different student issues. It can also be through events and engaging our students. There's so many different ways to do that. And yeah, I'll let my team take it over from here to talk a little bit more just about specifics. Well, I guess I'll say one more thing. So we represent students on our campus at our Board of Governors as well as at our Senate meetings. And this is an opportunity for the students to have a voice at the university level to talk about the issues that are facing them. And so we use this platform to elevate the student voice and then to ensure that student needs are being prioritized across campus. Externally, we do lobbying with the Students Nova Scotia and the Canadian Alliance of Student Associations. These two groups are lobbying groups, which basically means that we go to the Canadian government and we ask them to support students, both domestic and international, in many different ways. We've seen this go a long way in the past, and we hope to see it continue to have a lot of benefits in the future. So from here, how do we support students? And no, you go ahead.
Okay, hey everyone, this is Zaida. I'm the Vice President, Events and Promotions in the Acadia Students Union, and we are all excited for you to come and join us. And when you come here, we want you to know that there are so many resources you can seek out. I listed some of them here with Sterling. I'm going to start with ASU building. When you walk between buildings, you're going to see a bunch of them, and sometimes they're confusing to memorize, but ours is pretty distinct. We have a big sign that says ASU. That is our building. It is most of the time open. You can come, book rooms for your events, and it is obviously free for students. We have X-Bar. Again, it's a safe space for students to have fun, and there are events sometimes that are being held in the X-Bar. Then we have the website. Our website is an amazing website. If you Google Acadia Students Union, it shows up like the first link. You can go there. You can see almost everything. You can see who works in the ASU, who does what? What are we doing? Resources available, stores we have on campus. You can see many things. Please check our website out. And you can also see my email address, Sterling's email address, Sam's email address there. And if you have any questions, you can reach out to us. We have SHRC, Sexual Health Resource Center. You can get free products from there to just keep yourself safe. And we have food cupboard. Food cupboard is very popular. Students go there and they have hours, they post. You can go grab yourself vegetables, yogurt, fruits, whatever they have available. Again, it is free for students. It is a service that is being provided by Students Union for students. And we have Women's Center. That one is pretty self-explanatory. I just want to note that all of these services most of them have their own Instagram accounts. So if you go to Instagram and type Acadia students, you will find, again, our Students Union's Instagram. If you write Acadia Food Cupboard, you will find the Food Cupboard's Instagram, and that is where the most of the communication happens. So just go to the website, follow the Instagram accounts of these services, and make sure that you are ready for the school year.
Could I next slide, please? Hey everybody, I'm Sterling. I'm the Vice President of Student Life of the Union. I'm gonna take it from here a little bit. There were a lot of good services in the last slide. We don't want you thinking that that's it though. I can just about anything that you might need on campus, I can just about guarantee that we have something similar to it. And if we don't, please bring it to us because we really want to be as supportive of the students as we possibly can. A few more examples are our shuttle service. We have a van that runs around on campus and a little bit off campus to just bring students home if they're out on a late night study session. We have off-campus housing resources, people you can talk to if you need any advice with your landlord or with finding housing. That's in addition to Residence Life, which is also currently housed in our building, who is directly responsible for on-campus housing. We have the counseling center. For whatever reason, if you want to talk to someone about anything at all, they're always open. We have Cajuns, which is our merch store in the Student Union building. We've got some pretty good stuff there. Perkins, which is our student-run cafe. The ASU executive team offices, which are the offices which myself, Zahide, and Sam are in right now, as well as a few other people are in this hallway. But yeah, our door's always open, and if it's not open, then our email inbox is open. So feel free to reach out with anything at all. Next slide, please. So clubs and societies, I'm just going to go a little bit over what they look like. My role specifically deals with these clubs and societies quite a bit. So if you have any questions at all, feel free to reach out to me. I'll put my email in the chat in just a couple minutes here when I pass it off to Zahide again. So clubs and societies on campus are a pretty important part of our student way of life. There are a pretty big variety of different interest groups on campus, and we offer them support and services like a free mailbox and access to funding and free room booking in the Student Union building. And to get all those benefits and more, all you have to do is register your club with us officially. And you can also do stuff like call yourself the official Acadia Chess Club. And it says at the bottom there, Club Extravaganza, kind of like our club fair, will be held on September 4th. This will be a great opportunity for anyone who wants to get involved with the Acadia community to find groups of like-minded individuals who you might want to just hang out with, maybe play some games. We have a pretty big variety of different clubs and associations and all that. Say we've got, like I said, the chess club. We've got sports clubs, which are pretty active. We've got societies relating to all the different faculty departments. So if you're in psychology, say, I'm sure there's a psych society full of people who really want to talk to you. Now I'm going to hand it back to Zahide for a little bit of talk about events.
Yeah, obviously, as the Vice President, Events and Promotions, I organize some of the events, and most of the time, obviously, other ASU, Acadia Students Union members help me when I'm doing those. Like we all collaborate, and some of our events are Orientation and Welcome Week. If you will be here like around last week of August, first week of September, you are going to get involved with a bunch of orientation week events, and they're going to be fun. Please, like, don't close yourself to your rooms. Come out and join us. You will see our faces around. We will all be wearing our uniforms. We will be pretty, identifiable. Come talk to us. Say hi and just make friends, make connections. It will really help you feel more comfortable through the school year. We have homecoming. Homecoming might be a new concept for most of the international students. Myself, I am an international student. It was my first time learning about it. It is basically when alumni comes, schools, old graduates come to campus and you have fun. There are a bunch of events happening. It is one of the best times of the year. So I organized some events for the homecoming. And again, Sterling already mentioned this, that we also have events from clubs and societies that happen in the Students' Union building. We have other resources available in our building. And again, feel free to drop by, feel free to say hi to us. I also want to quickly add that I sent a few links to the chat, so you can go to our website and Instagram. Sam, you are muted.
Yeah, thank you. Thank you all so much for listening to our presentation. We'll take any questions, and I see these two emails here, but if any of you want to reach out to me, I'll put that in the chat as well. So thank you all so much.
Thank you very much for that presentation. That was great. So do any students have any questions for the ASU team? You can also put any questions you may have in the chat if that's more comfortable for you.
Tanya, I think you might be muted.
Sorry, I just wanted to mention one thing about our executive team this year to the incoming students on the call is they are really, really great. And I hope you could tell their enthusiasm from their presentation. They're a very caring bunch and empathetic. So, when they tell you to please come in the building and if you have troubles to go see to them, they're a great resource. And I think out of our executive team this year, we actually have 3 international students sitting on the executive team, which gives you new incoming international students a little bit of an edge to know that you have international students in leadership positions on your campus that maybe can see some things from where you're coming from as an international student with all the big exciting changes that are going to be happening soon. So good job, guys. Great.
Thanks, Tanya.
You're welcome.
So if there are no questions, we can move on to Tanya and the health plan. If you want us to take over.
Yeah, I'm going to share my screen now. I'll let everyone know I pre-recorded my presentation. I find I just do a little bit better when I do it that way. So I'll let that play. And then at the end, if there's any questions, I'll take them. I'm going to guess there won't be because these people tend to be pretty quiet on them. But just know that after reviewing it, if you have any questions or anything's bothering you and you're just like, oh, I didn't feel that made great sense, I didn't understand what she meant, just reach out to me. Let's make sure you're comfortable and feeling secure and ready to go for September. So I'm going to share my screen. And sorry, this might take a minute. Okay. Include sound. I'm not quite sure where. Can you guys see that?
Yeah.
Okay.
Yep.
But that's not really what I wanted to present.
if you,
I'm really sorry, everyone. I might need a little bit of help. If I,
is the recording in Canva? Like if you present it, will it play?
I'm not sure. How,
So yeah,
Here.
you might be able to.
Here it is. I think I have found it. No.
Probably it is a video on your laptop. I don't think it would be in Canva.
Yeah, content. Oh my goodness. I haven't had this. I haven't had this issue before like this. Okay, well, if I need to do it live, then we'll do it live. Okay.
Kenya,
Yeah.
did you want me to forward what you sent to us in the chat group? Because I played it.
I know I can play it. I don't know how to play it. Sorry, new incoming students. I promise.
Janet, if you have the version that you could play, would you mind playing it off of your laptop? Is that possible?
Yeah, I can do that. Let me
Okay,
just see.
thank you,
You watch
Janet.
now. Let's just see if it works on my. Yeah, it does. Okay, let's see if I can go back now and share my screen. So let me do a couple things here. Okay, so that's in that. Okay. So I'm just going to share my screen. Can you see it?
Yes. Yes, we
Can
can.
everyone see it? Okay. All right, so I think I'll just hit play.
Beautiful. Thank you very much.
Okay.
I don't hear the audio.
Yeah, I don't hear it either.
Does anyone hear it? No? All right, let's go back and see. But you see it. You can see it?
Can see it.
Yes.
Now, why wouldn't that be? Okay. So the mic is on. I have my volume up. So why would that be? Because does anyone have any techie ideas why that would be?
Zahide and I were just in a meeting where they ran into a similar issue with the video. I think there's some setting in the back of your computer or in the back of Zoom somewhere.
Okay, well, you know what? We can, Janet, if you want to stop sharing, I will just do the presentation live, I guess.
Okay.
Sorry, everybody. Okay.
Oh, that's okay.
Can everyone see that?
Yes.
Okay.
Yes.
Okay, perfect. So So my name is Tanya Camo. I work for the Acadia Student Union, and I am the Health and Dental Plan Administrator. Today we're going to be doing a presentation going over Acadia International Student and the medical insurance. All right. Sorry. So international students enrolled at Acadia University must have medical insurance coverage while studying in Canada, and they are automatically enrolled under the Acadia Student Union provided medical and dental benefits plan. The cost of this coverage will be added to your student account and is due with tuition fees. For the 2024 and 25 academic year, the total fee for the medical and dental coverage is going to be $995. That provides you with a full year's 365 days of coverage. The policy year will begin September 1st, 2024, and your coverage will remain enforced until September 31st, 2025. Sorry, there was just someone in the lobby, I just admitted. So also important to note, students who are studying in Canada for the first time are going to have access to something called early care coverage. Early care coverage will provide you with 30 days of coverage prior to the September 1 policy start date. There's no additional fee for students for this coverage, and it allows you to get settled into your living arrangements worry-free prior to classes. You can kind of roam around Wolfville and just get more comfortable with the community before you have to dive right in to classes and all that really hard stuff. With the early care coverage, I would like to mention that it is offered for fall intake students only. So next, pre-arrival. Is there anything you can do prior to arriving? Really the most important thing you can do is just review the coverage offered on the Student VIP webpage. And then also students are asked to disclose any pre-existing conditions to ASU supports. So a pre-existing condition may be something like you're a diabetic, or possibly you have recently broken your leg and that leg is in the process of healing. The International Medical Plan does provide coverage for pre-existing medical conditions, provided the condition was stable for 90 days before the policy start date. Really what that's saying, and insurance can be a little scary sometimes and you're not quite sure what they're trying to exclude, but a good example of this is if you're a student and you start a university in Canada and you're actually quite sick and maybe you're in kidney failure. If it's determined that you arrived to Acadia very sick and did not disclose to us that illness, that could impact your coverage. So just please be aware of that. Again, if there's any worry or stress there, just reach out to me and we can discuss it more before you get here. International students and your medical coverage. Really important to note, international students at Acadia are insured for $1 million Canadian in the event of an illness or injury. This policy provides coverage at 100% with no copay or deductible to the student. That means no out-of-pocket fees. The insurance plan pays everything up front at 100%. And instances where this coverage may be used would be a trip to the emergency room, if you needed to be hospitalized, emergency transportation, so you've taken an ambulance, visits to the doctor, emergency surgery, routine surgery, any type of medical procedure that's going to keep you at your best and keep you healthy is going to be covered. And then additionally, medical scans such as x-rays, MRIs, and CAT scans will be covered for you. And then lab tests such as blood work or any other diagnostic testing that would be required at the hospital level. Some extended health benefits under your coverage are going to be prescription drugs. As an international student, you should only have a $2 copay anytime you need a prescription medication. You have a vision care benefit, so if you need an eye exam, and as a result of that eye exam glasses, there's a benefit for those devices. Mental health counseling. In addition to the counseling department at Acadia, there is a benefit for private counseling. You know, this is good to use if you're feeling stressed, if you're feeling overwhelmed, or even just maybe a little homesick with a little bit of culture shock. There's some travel coverage built into your benefit plan. So if you need to travel for your degree, maybe you're going on a trip on winter break or even going back home, reach out and ask about that and see how that can help you. And plus more, there's more benefits included. I have gone over the most commonly used ones. I would suggest though, anytime you have to pay for a health service out of pocket, reach out to me and see what can be done there. Maybe nothing, but maybe there is something and maybe we can claim it and get reimbursement for you. And then we'll quickly just reach over to the dental side here, the dental benefits. At Acadia, all students have an annual combined maximum benefit of $650 a year to use towards dental services. Again, most coverages are at 100%. You will see like something like extractions maybe at 50%. The dental benefit plan is great for students who are just continuing with their dental hygiene. I will say if you know you need an extended amount of work, you might want to reach out to me and have a discussion about that and how that will look for you. All right. So how to use the benefit plan. Using your student benefits is easy. Basically, all you need is your benefit card. So students are required to present their benefit card up to reception upon arrival or during the intake process for any medical, health, or dental visits. Benefit cards will be emailed to students in early October. Students are strongly encouraged to save an image of their benefit card to their mobile device for easy access. I know that sometimes the benefit card not being generated until October causes a lot of stress and angst for the international student. We are going to try to get cards out a lot earlier this year. But I want you all to know on this call, if you do not have your benefit card on you, you are still covered. You still have 100% coverage. So please don't let that stress you out too much. And underneath here, I just put a section, what if you don't have your benefit card? So you may be asked to pay out of pocket for the service or product. That means something like a prescription drugs, possibly dental care. If you were to present to the hospital or you needed an ambulance to get to the hospital, your medical invoice will not be billed to you at that time. It'll be generated at a later date. So my recommendation is if you don't have a benefit card to show and you end up at a hospital, a Nova Scotia Health location, please email me and let me know that you presented to wherever you presented and that you did not show your benefit card, and I have the ability to go behind the scenes for you and make sure Nova Scotia Health has your information to ensure that claim gets billed properly. This slide, this is the benefit card. I wanted everyone just to have a visual of what it looked like. It's to the right there. It's just a blank template at this time, but you can imagine once you get here, you know, the insured name would be your name, and then we assign you a student ID, your policy number, and then effective date and termination date. So students can also download a copy of the benefit card from the ASU Supports webpage. I have click here to learn more. Please feel free to check that out and see how it looks, but know at this time that you're not actually going to be able to generate a benefit card for yourself. Your benefit cards will not actually be ready until at least September 1st when you start and are fully registered for Acadia. Now these next few slides, I'm not going to go over reading them so in depth just because they're lengthy, but I was asked to include these, and I think students, if you'd like to go back and have a look at these after the fact, that would be great. I have provided a little bit of information on where you can go to see a doctor or receive emergency health care while at Acadia. I will read this slide. It goes over the Acadia Health Center. So the Acadia Health Center is located on campus, and the physicians there will be your family doctors while you're away from home. I've added a link, click here, and you can be redirected to the Student Health Center webpage. Again, you can book appointments. At this time, you're not going to be able to book appointments because you don't have your student numbers or anything generated, but it will give you a good review of what the Acadia Student Health Center looks like and what services they can provide. Additionally, I've linked here the Valley Regional Hospital. This is the main hospital in the area. It has an emergency department and is open 24/7. It is in Kentville, which is 2 towns away from Wolfville and about a 15 to 20-minute drive. So again, these next slides are more meant for just students to review on their own time. It's about different levels of healthcare and where you can go to receive care for those concerns. So you can see here we have emergent, urgent, and routine. You can click on each of those to be redirected to some more information. Also, the same with dental providers. I have listed 4 dental providers that are within walking distance to Acadia. Each business is linked to their webpage, so you can go and learn more about those providers if you want to check them out before you actually get on campus. Making claims. Why would you submit claims? We'll go over this really quickly. Students would be required to submit a claim if they have paid for any medical, health, or dental services out of pocket. This could be due to the student not presenting their card, or if the office you present to for services does not accept direct billing. That probably won't happen very often. Close to Acadia, most of our providers do accept direct billing, but I want to make you all aware that if the provider does not direct bill, they do not direct bill, and you will have to pay out of pocket and submit. If you'd like to learn more about submitting claims, again, you can click there and be redirected. I always say, if you're a brand new student and you need to make a manual claim, just reach out to me and we can work on that together. I certainly don't mind helping and supporting that process. And I know this is really lengthy. Thank you for staying with me. We're almost through. The next slide is on I Am Well. I Am Well is the free mental health platform provided to all students at Acadia by the Student Union. They have on-demand counseling 24/7, as well as immediate access to mental health therapists to provide safe and confidential support to any time, day or night. Counseling options are through telephone, live chat, email, in person, over a portal or video. Also, counseling can be provided in over 240 languages, which can be helpful if you're trying to find the words to express how you feel, and English maybe isn't your first language or one that you are most comfortable in. You can also see we have the QR codes here. You can download this app for free to either Google Play or the Apple App Store. I'm going to go back to that one for just a minute, and I'm also going to note, sorry guys, that you are going to see a lot of I Am Well marketing stuff when you come in September, so just keep an eye out for that as well. And then lastly, we're going to go over the MyPeak mobile app. This is specifically for international students. Again, there's a QR code there that you can download this app. It is going to ask for a code for you to register. You are going to use the ASU INTL. I'm not sure, if I'm being honest, how many Acadia international students actually use this app, but you do have access to it if you'd like, and you can 100% download it. If you download it and like it or have any questions, please just let me know and I can answer any of those for you. And I think we have 2 more slides left. Opting out. This is a really important one, so please pay attention if you are an international student thinking about purchasing private medical insurance prior to arrival. And what opting out refers to is when a student submits an application for review to see if they are able to use their private insurance policy in place of the Acadia Student Union provided medical, health, and dental benefit plans. So International students who are thinking about purchasing private insurance to use in place of the ASU provided coverage must make sure their policy meets all requirements set forth by Acadia University, the Acadia Student Union, and Student VIP. It is very important to ensure any coverage you purchase meets this to successfully opt out. If the private purchased policy does not, the opt-out will not be granted and you will stay enrolled under both your private policy and the ASU policy. I just want that very clear so nobody's disappointed or upset when they arrive and maybe have purchased a private policy and had no intentions of purchasing the Acadia one. I do have, I do have a couple links there. You can click here to see the necessary information needed to submit the opt-out request. The requirements are pretty heavy. Again, if you're a student who's thinking of purchasing private medical insurance, please just write me an email and let's have a little brief discussion before you do that. I don't want to see any students having to pay for things twice. Just because, you know, that's not great for anybody. And opting in. I'm not sure how many of you on the call today are going to be traveling to study at Acadia with your spouse or children, but if you are an international person and you're coming to study at Acadia with dependents and or a spouse, you can add them onto your Acadia provided benefit plans. So again, if anybody is traveling with family, please let me know and we can talk about what that looks like. All right, so we've made it to the end. Thank you for listening. I know it's a lot. I know it's heavy and it's not the most exciting topic. You can see I have my name there. I am located in the Student Union building. Typically, I'm in room 301. For the summer, they have moved me to room 601. I don't think that will impact any of you because I think I'll be back in my normal office by the time you get on campus. I also have a phone number there. You can give me a call or my email, tanya.camo@acadiau.ca. Please reach out to me with anything and I will get back to you ASAP with answers. And then additionally, I have left the information for the insurance administrator company that provides the benefits, and that's Student VIP. So if anybody wants to check out Student VIP or learn more about them, you can definitely go to their webpage. And I'm going to stop. Oh, I stopped sharing.
Thank you, Tanya.
Thank you.
That was brilliant. That covered a lot of information, but it was really interesting. I
Okay.
mean, you know, it
Thank you.
was very detailed. Yeah, no, you were great.
I will say no one really wants the information until they need the information, and then it seems very important. So,
yeah,
but I get it.
Yeah.
Not come to university for insurance.
No, that's right.
Come for a lot funner stuff.
So with that said, are there any students here who've just listened to Tanya's presentation that have any questions? And again, you can put your questions in the chat if you're more comfortable doing it that way. And or again, if you have any questions about the ASU, since they're still here as well. Everyone is very quiet today.
I know.
Here we go. We got a question coming.
Okay.
You can see that?
I can see that. So the question was, what is healthcare medical situation in general for international students in Canada? Is there anything important that we should be aware about? So that's a great question, because I know depending from where you're coming from, healthcare looks really different. In Canada, we use a system called triage. I think that's going to be maybe the newest kind of issue for most of you. And what triage means is the sickest are seen first. So, you know, let's say you present to the emergency room. Well, unfortunately, on the day that you came to the emergency room with a broken arm, there was a helicopter crash. You're probably still going to have to wait because there's so many more sick, more urgent needs above you. So that's the most important thing to know, that hospitals and emergency rooms aren't really the go-to for care. You're really going to want to utilize the Acadia Health Center. You're going to want to utilize, in the documents I made, some other options. It's a hard question. I don't know, Sam, what would you say about that as an international student coming? I do think it looks a bit different for everybody, but.
Yeah, I mean, for me, like I'm an international student from the US, so the difference for me was that there's a little bit more grace when it comes to like the amount of money that you're paying for certain things, or like how much is being covered by your insurance. So the things that Tanya mentioned, obviously there's pretty broad coverage. It's complete coverage of many different things. And I would agree. I think triage is definitely something that people won't be very familiar with. Um, it doesn't mean like that you can't go, but it means if the problem that you're experiencing is not immediately affecting your life, like a broken bone will get seen at some point. It will take time. You will have to wait at the hospital for a little bit, but it will happen. But if you present to the hospital with a fever, and that's it, you're not going to see care very quickly. So it's about trying to figure out what's the right service to use, and you'll get used to that the longer that you're here.
Yeah, I
Yeah,
think Sam's absolutely right. Sorry, Janet. And I am going to work really hard this year at making sure we have documents that give lots of good options and good examples where to go for care. I don't think it's anything you should be overly concerned about. The one thing I might tell students incoming, if you're on any prescription medications, try to bring at least 3 months with you. That gives you 90 days grace to get a doctor's appointment and to get a new prescription. I know 90 days seems like a lot, but when you're starting university and having fun, you're going to have so much going on. It's going to go by like that. And then all of a sudden you're going to be like, oh no, I'm out of my medication. So if you can kind of bring what you think you need or things you typically reach for, I think that will just make you more comfortable.
Yeah, that's good advice.
Yeah.
Any other questions for Tanya or Sam? Well, oh, we've, Sam is following up. Oh, last question. Do you see that one, Tanya?
Yeah. Okay. So, the insurance is kind of the one where you saw between 10 and 20%. That was the dental coverage. The 10% dental is you're right. It looks very scary and it's the very least coverage you can get. That 10% coverage is a benefit for someone who needs excessive scaling on their teeth. So I'm not sure, this might be more confusing than helpful, but in the dental benefit plan right now, students have 4 units, which are 15-minute time periods where the dentist or the dental hygienist scales your teeth, and that's when they manually use those tools to remove the plaque and tartar off your teeth. So in the course of a year, you have an hour's worth of that covered. If you go over the hour, the every 15-minute allotment fee for scaling is only going to be charged at 10%. What I can say is, when you get here, come see me. We can go over it again if needed. But I also want you to know that very specific benefit at 10%, the dental offices in Wolfville are aware of that, and they do not go over those amounts of scaling because they've been told, but they're aware and they don't want too many out-of-pocket fees for students. So I hope that answers it. I know sometimes the answer can maybe cause more confusion with all the information, but for I think Isaiah, sorry if I'm mispronouncing your name, if you're in the hospital and you need care, that is 100% coverage for you. So the most important, like serious things are covered at 100% up to that $1 million cap.
Okay. So we're coming close. Oh, hi, Sam is typing.
Okay, perfect. Good. I'm glad that
That's
answered.
the piece of info he was looking for. There you go. That's good.
Yeah.
Any other questions for either Sam or Tanya?
Oh, I think we've got one more coming. I might have stopped. And you know, if it's not a question you want to ask on this platform in front of everyone, please email me privately.
Yeah, it doesn't look like that question's going to come through.
Yeah, I don't think so.
Oh, maybe.
Okay, so what insurance plan is the best for international students at Acadia? You know, I think the one the ASU offers is the best. And I'm not sure if you're meaning like, is it better to buy a private policy? I think I can't tell anyone what to do, but I do think the ASU plan is a great plan for international students. It's student priced. I know it's still costly at $995, but I also have seen the costs of private policies and they can be a lot more. Additionally, you know, students have me. I will advocate for you. I will fight the insurance company for you. So I do think it's a benefit to have someone here who's able to help you and who knows the plan. But at the end of the day, you'll have to decide, I guess, what is the best for you. But I do think the ASU plan is a great plan, and I really haven't seen any student that it hasn't worked for, or there's been something big that hasn't been covered. Like it's been useful in most cases, and we can find a solution for the need.
So any other questions? As our time is quickly, we're getting to the end of our session.
And I guess the last thing I'll say with the last question about which insurance plan is best for international students, if I misunderstood that, all international students at Acadia are on the same plan. So there's not a tiered plan. There's not good, better, best. You're all on the same coverage.
Okay, well, if there are no more questions, we can end this session. And it was very informative. And thank you to the ASU team. And oh, Nurdine is Same thing happened. Started and stopped.
It's back.
Can you do many students opt out?
Not with the private policy, they don't. Sometimes students, international students who have been here for a period of time and are nearing graduation and are looking to stay in Nova Scotia or elsewhere in Canada, move into like the provincial healthcare plans. I would
Right.
say I do more opt-outs of those, but again, privately purchased policies get really tricky when we're going between countries because, and I'll let the
Sure.
students know, the main reason is Canada has, cannabis is legal in Canada. In a lot of countries, it's not legal. So we need to ensure that your insurance plans from your home countries will cover in the event you're hurt or harmed while under the influence of what is now a legal substance in Canada.
Here in Canada, right.
So
Right.
that makes things a little bit different.
That's interesting.
Yeah, and we also, the ASU plans, getting a little heavy, but they also want to put protections in for students in case of like mental health crises or that are not always recognizable depending where you're coming from.
I'm just going to shut my window. I have someone mowing the
Sure.
lawn.
All right. Yeah, and we actually I've had a few students from Ghana who come, and yeah, we get them all set up. So I know the healthcare is going to look a little bit different to you than it does at home, but I'm confident that you'll be pleased and we'll take care of you. So
Okay,
yeah,
that's great. Okay, well, I think that should, that's it for today. The session's almost come to an end. And I want to thank you all for coming. And students, I hope you all tune in next Wednesday. We're going to have the Counseling Center and someone from Accessibility online doing the pre-arrival session. So, thank you all.
thank you.
Okay, and I should just mention that this session will be posted on the Wong International Center's YouTube channel.
Lovely.
Okay, thanks
Okay,
everyone.
thanks everybody. Have a great day.
Thank
See
you
you.
all.
Thanks
Bye.
for coming
Okay.
in.
Bye-bye.
Bye-bye.